So mid-March, with the declaration of a pandemic, actually our activity started before then in preparation, in simulation of how we would respond to a pandemic, and that was, we've always had the training, and within the months of January, February, and March, a lot more activity around simulation and practice took place. By mid-March, the declaration of the pandemic was made, and we immediately, with travel, especially around March break, we did see some cases coming in to the region, into the community, and we were in full pandemic mode. We had arranged to have pandemic units created in the hospital. We immediately implemented all the necessary personal protective equipment, PPE, requirements for our staff, for our visitors, and the hospital really went into the full restriction mode, as did every other hospital in the province. In the Simcoe County and in the community of Aurelia, we did not see the surge of cases. However, COVID was present in the community. We did see some cases through the hospital, which meant we always needed to be ready, and we continue to be ready because this is far from over. So over the course of probably end of March, early April, we were actively doing surveillance for COVID. We did find some cases. We did have to treat COVID patients, as did many hospitals. And our emphasis at the time was ensuring that we can continue to provide emergency care to patients, to the community, keeping our staff safe and supported throughout the pandemic. And also our goal was to communicate effectively with all the uncertainty. It can't be understated how much anxiety was present within the organization, and we did our very best to get the message out to people, let them know in a very dynamic environment where rules are changing on a regular basis, to let our community and let our staff know what the plan was and how we were proceeding forwards. We need to understand that pandemics come in waves, and we have the opportunity to, we've gone through our first wave. Every pandemic has had a second wave, so it is a matter of time. And globally, you see the volumes of cases growing exponentially in areas, in other places of the world. So we know where this is far from over. Based on the current statistics in our community, there is reason to relax, and that's the government's prerogative in terms of determining the phases. And the key message that I would say is we need to do so smartly. It doesn't mean we need to carry on with lives, but we need to do it in a safe way, and the two are not incompatible. We can move forwards with reopening, but we have to do it in a safe way. It's very difficult to speculate what the impact is of testing and how much testing is being done. I know our organization, our assessment center, is doing record numbers of testing. The positivity rate is very low right now, but we are testing more than we've ever tested before, so we are looking very hard, and that's the key element, is identifying those first cases and acting very quickly. So we are doing that. I think there's a number of factors that determine the extent of an outbreak in a community, and whether it's the density of the population, whether it's adherence to the protocols, whether it's events that occur that create breaches. I couldn't tell you which one was the singular event, but I know maintaining the protocols, maintaining the physical distancing, hand hygiene, and mask use, those are all very helpful elements to prevent either a wave from occurring, perhaps reduce the severity of the wave, delay the wave, short the duration. All these things would be better than just having COVID come through the community unchecked. So in my garage, I have set up my own workshop, a sewing workshop, recognizing that it is so important to get the word out that masks do work. This is what we've learned over the first wave in other jurisdictions. We've seen other countries where mask use is more prevalent, and it has reduced and helped accelerate the recovery. So it's better for health, mask use. It's better for economics. The sooner you recover, the sooner businesses can reopen and reopen safely. So I really wanted to get the message out to do that, to encourage mask use. And part of it is making sure people have access to masks and having the cloth masks, which is being recommended for the general public use. So I pulled out an old family sewing machine, got a few lessons, and started making masks for the community. So there's two differences in masks. So the masks we use in hospital, that is protecting the wearer of the mask. And it's part of their equipment, their safety equipment, PPE, and that's separate. When we wear a mask in the community, it's not a medical mask. It is a homemade face covering. What that does is it prevents the spread. So it prevents the wearer from inadvertently spreading virus. Oftentimes, what we've seen and learned is people may not recognize if they've been infected, and therefore wearing a mask is a sign of respect to the people around you, to say, I'm looking out for you. And it also indirectly helps everyone, because the less likely the person beside you is infected, the safer we will all be, and we all benefit from that. So there is something to the fact that if we're all wearing masks, and even if 80% of us could be wearing masks, not everyone can wear a mask, and that's generally accepted. However, if the majority of us are wearing masks, we can break the chain of transmission, and it just doesn't allow COVID to take off in that exponential growth, and that's why it's helpful to communities. But it needs to be a movement within a community. It needs to be something that's adopted, widespread within the community, and it will, if we all do our part. And yes, in hospitals, we're used to wearing masks. We've been wearing masks every day since March. Now we are encouraging the community to do so in specific circumstances. So we're asking the community to wear masks in indoor public spaces, in outdoor crowded areas, and public transit. I'm using leftover t-shirts from an event, which are purple, soldier's color, with the emblem, which is a nice touch. So I'm up to about 130 masks that I've made so far. And our goal at the organization, we have a group of community partners, organizations that focus provision of care for various agencies that help underprivileged or marginalized groups. And our goal is to get masks out to all those that may not otherwise be able to afford masks. So we'll be doing deliveries this week. We already have our first orders. So we'll be going out to those organizations and offering masks to whether they're residents of a men's shelter or women's shelter, just to make sure that all of our community is supported. So this gives you a sense of the final product. So I have a variety of masks in purple here, and we have a different, as you learn, you get better, and you get different styles in place that are pleated masks that can be worn. And again, not intended to be medical grade or anything that I would suggest to any of our staff at the hospital, but a mask that is comfortable, that can be worn in the community, that provides that extra layer of prevention, just so that in all good conscience we're not, if any of us happen to get sick, we're not spreading the virus to others. And we hope to flood the community with masks. I'm encouraging others who have the capability of making masks. We have our foundation, our volunteers. We have an army of volunteers that are making masks. They've made thousands already. And hopefully I can inspire them to get back at it. It's been a long haul over the last 4 months, but we want to recharge that group to continue to make masks, and call out to industries, the clothing industries that have the capacity to make mass-produced masks. To do so, we've seen some great examples of industries and companies retooling their equipment to support COVID. I think this would be a great idea, just to make sure if you offer masks to people, I've noticed it anecdotally, people will accept and people will wear. So we want to offer as many masks out there as possible, and hope that provides added encouragement for mask use. So I'd like to call out to the entire Orillia community. This is our opportunity. We have a defined window of opportunity where we can be in control of how we choose to respond to COVID-19, and we can all do our part. And I think part of that is regular and frequent hand hygiene, physical distancing and wearing a mask in indoor public spaces, outdoor crowded spaces, and on public transit. And that's how we can keep ourselves safe, and that's how we can keep each other safe.